Hey, can you hear me okay?
Yep.
Nice. Does it look too dark in here?
It looks like you're in, well, what it looks like you're in a recording studio or
I
something.
am.
Okay.
Just, this is my partner's recording studio. It's easier
Okay.
for me to work down here when there's children running everywhere.
Well, that's why I go in my basement, but it's like super ugly and has like exercise equipment behind me.
Whatever. Fine.
We have one home office, and like because my husband works full time from home, he usually, like, unless I really need it, he usually claims it. So
Really?
it's kind of work wherever.
Well, that's it. That's totally it. Do you want to try and share your screen there?
Yep. Oh, host disabled participant screen sharing.
That's weird. I'm going to just make you the host.
Okay.
That might mean that you might need to let people in on the waiting room. I'm not sure. Try that now.
Okay, it says practice mode only. Attendees cannot join until you broadcast. So, share. And then I'm gonna, oops. How do I actually play this slideshow? Okay. That working?
Perfect.
Okay.
I'm just going to see if I take the host back, if it disallows you to do that. Okay, now try to run through your presentation. Nice. Okay, wicked. That's awesome. I need to take my earrings off. They're getting squished.
I find like I haven't done much like presentations from home. Like when I do a big presentation, there's usually people there, and it's a little like unnerving to do them without like the visual feedback from people, I find.
Yeah, I was thinking
so
about
weird.
that actually. I don't know if I can enable people's video, but that's
No, that I don't really want to see that either, but like but like just it's so much easier in person when you can see people like nodding along and stuff, whereas if you're just like going through slides and you don't even know who's all watching or who maybe is left to go to the bathroom or whatever, like it's just sort of like I'm talking and I don't know if anybody's listening anymore.
Yeah, you know what? I think that that's actually something that I've done with our team, just in sort of mandating that they keep their videos on, and like there's lots of times where somebody will just like quickly run to the bathroom or whatever, but like not cool if you're just sitting there like watching the TV.
Yeah.
And I always assume the best of everybody, but
yeah,
you just never know.
well, I mean, I admit that I've done it when I've had to watch like webinars and stuff for school, especially when it hasn't been something relevant to me that much.
Totally.
But I had to go to it, so I just like start like looking at my phone and I'm like, well, glad there's no video on.
Oh, totally. So I know.
Question, can they like see me like while I'm sharing my screen? Can people also see me as I'm talking like on my webcam?
Yeah.
Or how does that? Okay, so they can. So I shouldn't like pick my nose while I'm.
Yeah, you know what? We're doing this like community fundraiser, my partner and I, with these t-shirts that we're selling for the COVID response, emergency response. And we recorded we recorded a conversation with the lady who's administrating all of the emergency response. And I didn't think that that was going to be something that we were going to be using. And so Derek cut it up and put it online to share with people. Like, I thought you were going to just use the voiceover stuff. But here I am, like lounging, and I'm taking like big drinks and like putting on a lip cap, and I was just like, "Oh Jesus!" Oh, it's so embarrassing. I just realized that I was going to, I wonder if it would be relevant for me to read the actual commitment.
Yeah, probably. Like, I guess we're not putting it on the screen, hey?
I don't have
Do
it
you want
yet,
it?
sort of in a finalized
Oh, okay.
format.
Gotcha.
So I think it would be okay just to read it, hey?
Yeah.
I'm going to find it here on my phone. Okay. I had one person submit a question
Okay.
just now, and her question is, so, you know, we're not going to have like all the answers for how they conduct their business, but I think that this is sort of an opportunity to suggest what types of controls they can put in. So her question is, how do we reopen restaurant and beverage spaces, especially small spaces like ours, in a way that is safe for staff members to work in? I feel like there's a lot of directive from the government creating safety and operating centers, but there are a few resources for keeping the people staffing these businesses safe. So this is the whole purpose of all of this, right?
Yeah. Yeah.
Um,
So I think like hopefully that question will kind of get like, I mean, it's not going to answer exactly like here's exactly what you can do, but like here's how you can work
totally,
to figure that out.
totally. Okay, I'd like to let everybody in now. Are you cool with
Okay.
that?
Yep.
I'm just going to mute myself. Good morning, everyone. Thank you so much for joining us. We are just going to wait a couple more minutes until we get our full attendee list in the webinar and we'll start. Okay, everyone. Welcome to yet another Primed Academy Tourism webinar from Tourism Saskatoon. Very happy to have you all here. Thanks everyone for making time. I just want to start our webinar today by acknowledging that we reside and conduct our business on Treaty 6 territory in the homeland of the Métis. We pay respect to the First Nation and Métis ancestors of this place and reaffirm our relationship with one another. I am very excited to talk about this project that we have all been working on. And so with me on the call today is Robyn Reist, and we will be presenting the Saskatoon CommUNITY Commitment. And so Robyn is driving the presentation today. So Robyn, I'll just ask if we can advance the screen 2 slides and we'll get started. So I'm really excited to introduce to everybody on the call today Saskatoon's CommUNITY Commitment. I first of all want to start by saying thank you. Thank you to everyone for doing their individual parts in keeping us all safe. And I also want to praise the readiness and solidarity of our sector in supporting the response to the health emergency by either closing your doors completely or augmenting your operations to continue to provide service. You have demonstrated leadership, resilience, and compassion, and it's very obvious that the work that we've been doing has worked. Our work to develop the Saskatoon CommUNITY Commitment is an effort to honor this hard work and dedication by making Saskatoon a great place to be and to be from. Tourism Saskatoon keeps our community at the heart of everything that we do. And as the province of Saskatchewan launched the Reopen Saskatchewan plan, we knew that there was as a destination, we must provide additional support to ensure businesses had the resources required to develop their own internal controls that prioritize the health and safety of their staff and thus ensured safety and security for their customers, our community, and the visitors that will return one day. The process that we are launching today starts with the webinar that you are all about to experience. I would be remiss to say that our partnership with Robyn Reist has been invaluable. Her expertise has opened our eyes to so much that was far beyond our reach. And so I'm really excited for her to share all of that knowledge with you today. In watching this webinar, you're about to learn how your business can mitigate as much risk of COVID-19 transmission as possible, and either check your already developed internal controls or create new ones to support your operations. The worksheet documents that you would hopefully have all received. If you haven't yet, please type your email into the chat function and I'll make sure that you get them sent to you. Will be the process by which Robyn walks us all through to operationalize all of the information that you're receiving today. Once you have completed this process by watching this webinar, by going through the worksheet in your own business, you are then ready to be a Saskatoon CommUNITY Commitment partner. We will provide follow-up details as to where you can request all of the printed documents in the commitment, also digital graphics that you can share on your website, and logos that you can place in your business. I have learned so much from Robyn, and it's not just Robyn that has been working as a team, and soon we'll be able to share the members of this task force that has been working. It has been an unprecedented coming together of people from all areas and all different sectors of our city, and I want to just thank every single person who has been sitting on that task force, and in the respective time, I won't name all of them, but we will share that publicly today in our media advisory. But right now, I just want to share the commitment that will be able to be displayed within your businesses, on your website, and on our website as well, that will unify Saskatoon around our commitment to safety and security. It begins like this. We acknowledge that we reside and conduct our business on the Treaty 6 territory in the homeland of the Métis. Our commitment to a culture of safety and security is rooted in a deep respect for the citizens of Saskatoon. We consider the safety and security of our staff, customers, and the wider community to be of the utmost importance and are taking proactive measures to reduce the risk of COVID-19 transmission at our business. We have developed a program of checks and protocols to tighten our already high standards of hygiene and cleanliness. and we have adapted our business to incorporate physical distancing of staff and customers. These new measures are designed to meet or exceed current public health guidelines while being effective, sustainable, adaptable, and inclusive. Our staff are working hard to reduce your risk. In return, we expect you to take appropriate measures to protect our staff and your fellow customers. If you feel unwell or have a fever, please stay home. If you need to sneeze or cough, please cover your face with your arm or a tissue. Thank you for your assistance in making sure we keep our business a safe place for everyone. You can learn more about the protective measures we are taking at tourismsaskatoon.com. If you have any questions or feedback about the conditions we have put in place, we would be happy to discuss. Just ask. And with that, the launch of the commitment, it is my pleasure to introduce Robyn Reist, and just a little bit of Robyn's background here. Robyn is a registered professional engineer receiving her Bachelor of Science from the University of Saskatchewan. She's worked at Cameco for about 7 years in 3 different roles, one being a radiation specialist, an internal management systems auditor, and a health physicist. She has recently completed a master's degree in communication and population health science at the University of Saskatchewan in the College of Medicine. Her work as of late has been with RCH Consulting for just over a year, where her project focus is in the mining industry. Her specialty is in occupational hygiene, which means largely invisible hazards that can cause long-term health conditions, which has lended so incredibly helpful to her work on this project and for our community. Without further ado, I'll just take it from here, Robyn, and thank you so much for your work.
All right, thanks, Steph. Thank you, everybody, for tuning in today. The presentation that I've put together is called Thinking Beyond the Mask, and I kind of see this as a play on thinking outside the box. And so it's not about why you shouldn't wear a mask or anything like that, but it's about implementing really effective controls for controlling COVID-19 transmission that actually really work for your specific business. It's not about just taking a list of stuff and implementing it, is figuring out what actually really works well for your business. And so this is part of the community commitment, and it's all about teaching you best practices for, I'm sorry, I'm a little bit nervous because of this big webinar, but it's about putting best practices in place and teaching you what is a really well-established practice for developing these types of controls. It's used in the safety industry very widely. It's not a secret or anything, but it's not super well known outside of heavy industry. So I'm going to go through that today. So the learning outcomes for this presentation, and things should go a little smoother from here for me, is to define a health and safety risk assessment, identify what the transmission risks are for COVID-19, so you can actually identify where they are and how you can put controls in place, and learn how to apply that risk assessment process for developing controls that are meaningful and effective. It's also about understanding the limitations of less effective controls like PPE and procedures and rules, and going through the risk assessment worksheet that we put together. We'll go through the examples that you can see on the worksheet, and if there's any questions about that, we can go through that at the end as well. So what is a risk assessment? It is just a really common practice that's used in a variety of industries. As I mentioned, it's not a secret, it's not proprietary or anything like that. But what we've developed here specifically for Tourism Saskatoon partners is a modified and simplified risk assessment process that specifically addresses risks of COVID-19 transmission. And so if you already have a risk assessment procedure in your business, you can use that. This maybe will be a bit of a refresher, or it might complement it, or it might be totally new to you. This webinar is not meant to conflict with any guidelines that you're already supposed to follow, such as Reopen Saskatchewan or anything that has been provided to you from your professional organization. It's just a process that can really help you sort through the noise and sort through the big lists of stuff that you don't know what you're supposed to use and what you should, and just understand why certain controls are actually necessary and why certain controls are going to work better than others. So if you've read Reopen Saskatchewan plan, you've probably seen the part where it says, have you done a walkthrough of your business to figure out where all the transmission risks are? This is just how to do the walkthrough, but it's a bit more of a structured way to learn how to do it and think about it. It's just a way to kind of train your brain. So the risk assessment process, there's really just 3 simple steps to it. The first is identify what the hazard is. And the hazard is just the thing that could potentially cause harm. So I've just got this guy slipping. A hazard in this case of a wet floor would be the actual water on the floor. That's the hazard. And then you ask the question, is it possible for that hazard to cause harm if there aren't any controls in place for it? And this is the risk. The risk is the chance that the hazard will cause harm if you don't do anything to control it. And then the third question you ask is, how can we best minimize the risk? And to do so, the thing that it works best, I find, is oops, sorry, I was just moving something, is the hierarchy of controls. And you may have heard of this if you've taken any safety training course at a different organization that you've worked at, or through the provincial government in the OH&S training. You've probably heard of the hierarchy of controls, and it's all about figuring out which type of controls are better effective. So at the top are the most effective types of controls, which involves physically removing the hazard, or replacing the hazard, or doing things to isolate people from the hazard, or designing systems to keep people away from the hazard. And as you get closer to the bottom of the hierarchy, we would say these controls are a little less effective, such as administrative controls, which is like procedures and training to keep people from going near the hazard, or using personal protective equipment. One way that people often talk about PPE is they say that it's the last line of defense. And so it should really only be used if you've already tried a whole bunch of other things to keep people away from the hazard. Because once you get closer to the bottom, the least effective types of controls, they involve a lot of rules and a lot of things to remember, whereas the top is a lot easier just to follow because they don't involve rules. And so this graphic here is from NIOSH in the States, but you will see hierarchy of controls referenced everywhere. For example, in WorkSafe BC's COVID documents for a variety of industries, they do talk about hierarchy of controls. So going back to the question, how can we best minimize the risk? It's important to understand that unless you're fully eliminating the hazard, you cannot be sure that you're actually preventing that risk from occurring. So otherwise, unless you're totally eliminating it, there's really always going to be some risk of that hazard causing harm. So it's important that when you are especially dealing with COVID, not to tell people that you have implemented controls that guarantee their safety, or that guarantee that they're not going to get COVID in your business, because you can't guarantee that unless you basically just stay closed. So but the good news is that the more higher level controls that you use, like elimination or substitution or engineering, that you implement them, the more effective your risk reduction is going to be, but it is very unlikely that you'll ever get it to zero. So effectiveness, all that really means, I tossed around that word quite a bit, it's just the degree of foolproofing, or other ways to think about foolproofing. You could say idiot proofing, you could say mistake proofing, and I think this is what they use in training for like lean, and that's really what it means. So as you go lower in the hierarchy towards administrative and PPE, as I mentioned, you're going to have more rules to follow to make those controls effective. And as you go higher up, there's less rules to follow, and less rules mean more mistake proof. More rules mean they're really not mistake proof. And the less mistake proof or foolproof that a control is, as well, the more inclusive it is going to be, because it's not going to rely on people being able to think a certain way, or having to be fully able-bodied or something to be able to follow that rule. Or even just thinking about children, kids have, it's going to be a lot harder for a kid to use PPE properly or follow administrative controls than an adult. So these types of controls will be a lot more inclusive, and just able to be, if they will work for everybody, no matter if they forget to use their PPE properly or don't see a sign or things like that. So first, I'm just going to take you through a risk assessment for a conventional hazard, which is just that wet floor that I talked about. This is something everybody would have dealt with at some point in their life, in their business. And so this is just how it would work for that. So first, we identify the hazard, which is a wet floor. And then the risk is that without controls, a worker or a customer is likely to slip and fall, and they might get injured. And then usually when we're doing a risk assessment, we do also do a rating on likelihood and severity, but because in this case we've simplified it for COVID, the likelihood and the severity of getting COVID seems to be not super well known yet. So we're just kind of simplifying it and taking that out and just assuming that we should be controlling for all of the potential transmission risks that we see. And so then the possible controls, going back to this specific risk, is we ask the question again, what is the best way to minimize this risk from occurring? And we also need to consider the feasibility of this, of putting these controls in place, such as costs and social factors, which I'll talk about on the next slide. So how could you possibly eliminate this risk? Well, maybe don't wash the floor. You're removing the wet floor, but that's probably not feasible because maybe your health inspector requires you to wash the floor a certain amount of time to keep your business clean, etc. So if you can't do elimination, think about, is there a way to substitute that hazard? So maybe, I don't know if this is a thing or not, but if there's a cleaning agent that doesn't get the floor wet, you could maybe use that. If that's not feasible, or if it's way too expensive or something like that, look into engineering controls, maybe locking off the area completely until the floor is dry, or even just putting up barricades so that people can't ignore them and can't go into that area. If this isn't feasible, or if you think you need to layer a bit more controls on so people really see it, maybe putting up a caution wet floor sign. But as you can see, as we're getting into administrative type of controls, not everybody might see a sign. Maybe in certain cases, people can't read the language on the sign, etc. So it does start to rely on people actually following that sign to keep them safe. And then if the situation warrants, PPE would be something like maybe everybody wearing boots with special grips so they don't slip on the floor. And as you can see here, like, you can start to see the limitations of that, because how are you going to make sure people remember to put on their boots properly? Or what if they just start wearing them all the time because it's cumbersome to put them on, and then they just kind of get complacent about even using them properly and things like that. So that's just a quick example of a risk assessment for a really simple conventional safety hazard. And going into this feasibility question as well, looking at costs and social considerations. So costs mean, can you afford it, or is it feasible to pay for it as many times as you need to, for example. And not being able to afford it doesn't necessarily give you a free pass to ignore the risk and just not do it, but it means that you should come up with something alternative. If it's too expensive to control it in one way, what else are you going to do to control it in a different way that is going to be more affordable for you? And social considerations means, can you reasonably expect your customers and staff to actually adapt to it and support the implementation of the control? If they can't, you can try and make them do it, but if they really hate it, maybe your customers just aren't going to come into the store, and that's not reasonable for you. So if you're not going to be able to get your customers or your staff to follow this control, then you will have to, again, come up with something alternate that works for them. So now that we've gone kind of through the conventional hazard, we'll talk about the COVID-19 transmission risk that you want to be controlling for in your workplace. So the first type of transmission risk, it's kind of divided into two. And the first is person to person. And this is what we would consider the priority. According to the existing evidence, this seems to be what the main way that COVID is transmitted, from person to person. And so there's a couple ways it could be transmitted this way. The main one, it seems, is transmission via large respiratory droplets. So that would be from an infected person's respiratory droplets getting into your respiratory system. So inhaling an infected person's cough or sneeze. Or potentially, there's also some evidence that there could be transmission via small respiratory droplets. So this would be more from prolonged contact, like a conversation taking place over a certain amount of time in a poorly ventilated space, especially where those smaller droplets aren't being ventilated away. And then there's also surface or contact transmission, which is where you would potentially touch something with an infected person's respiratory droplets on it and then touch your own mucous membranes. And it's just important to remember that the contact transmission, it does have to come from their respiratory droplets that came out of their mouth, or from a sneeze or something like that. And then you touch that very soon after it gets on that, and then touch your own mucous membrane. So it doesn't ooze out of the pores in their fingers, for example. They actually do have to have gotten that out of their respiratory system to get onto the thing. So the way to simplify these transmission risks, because there was just a lot of information on that last slide, is kind of 3 questions. So how can we keep people at least 2 meters apart? And this should be your priority. And the 2 meters is kind of relative. This may change. I know some countries are already going down to 1 meter. So just keep this 2 meters in mind as the guidance might change. Maybe this goes down to 1 meter, but right now in Canada, it is 2 meters. So if this isn't possible, then the other question to ask is how can we prevent people from getting respiratory droplets on each other? And then the next question, how can we ensure that people don't have to breathe the same air for extended periods of time? And how can we prevent people from touching things that might have infectious droplets on them? And if that's not possible, how can we ensure people are able to wash their hands after doing so? So you might already be able to recognize that the larger font questions on this slide are related to higher level controls like elimination, substitution, and potentially engineering, and the lower level are maybe more, could be engineering, but likely administrative and PPE type of controls. So how to perform a risk assessment for these transmission risks? First, consider the unique tasks that your business performs and break down each job duty into a list of steps. And so this is like a step that would have its own unique transmission risks. So if your business is Subway, for example, making the customer's order would be one step, not put lettuce on the bun, put tomatoes on the bun, put cheese on the bun. Those are not all unique steps. And then consider the potential for each transmission risk for each step. So ask those questions. And then start from the top of the hierarchy of controls, starting from elimination. Consider what controls you might be able to implement to reduce the risk in each of those steps. So keep in mind that higher level, more foolproof or mistake-proof controls, they might seem more expensive because they usually have a one-time setup cost, but once you pay for it the one time, it kind of starts to pay for itself in the long term. And then if your only feasible controls that you're able to seem to put in place are administrative controls and PPE, some things to consider would be that these types of controls usually will have an ongoing per use cost, and they may or they may not be sustainable in the long term, both sustainable financially, sustainable environmentally, and sustainable in making sure people keep following them and don't get complacent. And then the big question is, can you rely on your customers following these rules in order to keep your employees safe? Because it's not really reasonable to be able to be policing your customers' behavior all the time. But if this is the only thing you have in place to keep your employees safe, you really should think about if there's anything else you can possibly do. So what I'm going to do now is I'm going to go through, because I maybe have kind of glossed over the hierarchy so far, I'm going to go into detail in each step in the hierarchy and talk about what this really means for COVID transmission and some of the common solutions that have been suggested so far in Reopen Saskatchewan, for example, or what we've seen in a lot of businesses and things like that. So elimination is, what it means is eliminating the need for people to be less than 2 meters apart, or eliminating the need for multiple people to touch things, and eliminating the need for multiple people to breathe common air for extended periods of time. And so some common solutions here are like performing tasks remotely. So work from home, that's elimination. You're eliminating the ability of people to be close to each other, or just staying closed. And these things would reduce the risk to effectively zero, but it's not really reasonable for a lot of customer facing tasks, especially in the service or tourism industry, to eliminate everything. And so you may find, if you're going through your own risk assessment, that elimination isn't totally feasible for a lot of what you do, but it might be for a couple of things. Substitution is all about substituting the need for people to be less than 2 meters apart, or substituting the need for multiple people to touch things, or substituting the need for multiple people to breathe common air for extended periods. In some versions of the hierarchy of controls, elimination and substitution actually get combined. I mentioned WorkSafe BC, and they combine elimination and substitution because sometimes people do have issues telling them apart. So if you find that you are having issues with this, just do your best and don't worry about really whether something fits into substitution or elimination as you're going through, as long as you know that it is a higher level type of control. But some common solutions that I've seen so far for substitution: curbside pickup and delivery, for example. So you're substituting the need for the customers to even come into the store, which is great. Customers seating themselves instead of interacting with a host in a restaurant, using like a chalkboard or a digital menu instead of passing out menus that have to get touched and disinfected, using disposable items instead of reusable items, and then having the customers dispose of them so your staff don't have to touch them. This one might be a little controversial because it probably doesn't fit with a lot of people's environmental goals. So again, that's something to keep in mind regarding feasibility. And then conducting some business activities outdoors. So this would substitute your indoor ventilation for what we know is a safer outdoor ventilation. Engineering controls is all about designing out the ability of people to be less than 2 meters apart, or designing out the ability of people to cough in each other's faces, designing out the ability of multiple people to touch things, or designing out the ability of multiple people to breathe common air for extended periods. So engineering sounds kind of fancy, but you don't have to have like an engineering degree to do engineering controls. It is really just about it can be some really, really simple things. So some common solutions of engineering controls are the plexiglass barriers that we're seeing at counters. This puts a barrier in between people, and even if somebody does sneeze without covering their mouth or anything like that, that glass is going to protect the person behind it from getting sneezed on. Extended countertops. So I've seen in a few places they've extended their cashier countertops so you physically cannot get within 6 foot of the cashier, and putting up barricades in aisles to promote the flow of one-way traffic. On-off motion sensors in bathrooms so you don't have to touch the toilet thing or taps, or using automatic doors so people don't have to touch the doors, or even just propping a door open is an engineering control. It's really, really simple, but that is engineering out the need for people to touch the door to open it. And then improving indoor ventilation is an important type of engineering control. This can be as simple as opening windows and doors and just keeping them propped to promote more outdoor airflow, keeping bathroom vent fans running, so if somebody goes in the bathroom and coughs, that air is continually venting and not just sitting there, or potentially using air purifiers in smaller spaces. And I've got a couple examples here on this slide because engineering controls don't have to be boring. I've seen some really fun examples of engineering controls that people are using, and they're cool because they're things that are keeping people safe, but they're also like probably getting more business through the door, which is kind of the ultimate goal of safety controls. So one example is these bumper tables that I think it's a restaurant in Maryland in the States that put these in place. So they prevent people from physically getting within 6 foot of each other, but they're also super fun. And I think they would, make people want to go there and use them. And then this is a new one from Regina Public Library, which I think is really awesome. So this is for curbside pickup of books so that the staff don't have to go and physically hand the books to the patron. They just put them down this alligator slide, and then you grab your books out of the alligator's mouth. And it's just super cool. And these are really fun things that are great examples of engineering controls that also like promote people wanting to use them. And just on that note about ventilation, there's not a lot about ventilation in a lot of guidelines that I've seen so far. One set of guidelines that has been created that does talk about what constitutes safer ventilation for COVID-19 is the American Industrial Hygiene Association Back to Work Safely guidelines. And industrial hygienists are admittedly obsessed with ventilation because we know that it is the most effective control for any kind of airborne hazard. And so if you know that your business has really bad indoor ventilation, this is something I would recommend looking into. Now moving into administrative controls. So this is the slide with the most words on it, and that is a good indicator of the kind of cumbersomeness of how administrative controls work. So it's all about making policies or procedures or training for keeping people 2 meters apart, or preventing people from coughing in each other's faces, preventing people from touching things that might be infected, or making sure they can wash their hands after, and then ensuring people don't breathe common air for extended periods of time. So some of the common solutions we've seen, and I would say that a lot of the main solutions that I've seen most places putting in place are administrative controls. And keep in mind, again, that this is not a mistake-proof type of control. It does rely on people following these rules to keep everybody else safe. And so Some of these solutions are 6-foot indicators that we have in lineup areas or directional markings. So, you know, if you don't see those indicators or if you step off of them, suddenly you're not necessarily, the control is no longer effective. Cleaning things that have been touched and used. And I mean, we can't get around the cleaning thing. That is a requirement to be done, but just to keep in mind that if things aren't cleaned properly, again, that control of cleaning isn't necessarily as effective as you expect it to be. And same with hand hygiene. If you don't wash your hands properly, then you can't necessarily say that you've eliminated the virus off your hands. Limiting capacity or time in a business is a type of administrative control. And this is something that obviously you can see why customers may not like this type of thing, because nobody likes waiting in line. Nobody likes being told they have to get out and stop browsing, things like that. Having a no small talk policy to reduce the amount of respiratory droplets in general. This is, again, something that's like hard to enforce, and it is a rule. Or using a non-medical mask use policy. And maybe you're confused about that one, like, aren't masks PPE? But non-medical masks are well established to not be, they're not considered PPE because they are made to protect other people from you, not protect you from others. And the definition of PPE is personal protective equipment. So I wouldn't put non-medical masks as PPE. They're kind of this weird hybrid of like PPE type of PPE, but that isn't PPE. They're more of an administrative control. Maybe they're more of an engineering control, but they have the effectiveness of PPE or administrative controls. So I'm leaving them in administrative controls, and I will be talking lots about masks, don't worry, because it is something that everybody always seems to want to talk about. So moving into that, personal protective equipment is all about wearing equipment that if it's used correctly, it's officially rated to protect you from breathing in infected respiratory droplets or getting them on your mucous membranes. So they have to be, if you specifically need personal protective equipment, it needs to be something that is approved to be personal protective equipment for this type of a virus. So the types that are appropriate for COVID are, if it's a droplet protection that you need, something like a medical grade surgical or procedural mask, a medical gown, safety glasses, maybe a face shield. Or if you have an actual aerosol transmission risk, then you would need respiratory protection. And if you're using respiratory protection, so like an actual respirator, like an N95, you need to follow the OHS regulations for respiratory protection use, and I will touch on that in the coming slides. So these last 5 slides have just gone through some examples of how to use a hierarchy of controls for COVID, but are not exhaustive. And I am going to talk a bit about masks now to hopefully clarify any misconceptions, but if you have questions, you can ask me as well. So it is important to recognize that non-medical masks, so a cloth mask, for example, or a mask like that's been maybe 3D printed, or something that's been found to be a counterfeit KN95 that doesn't actually filter appropriately, are not allowed to be considered personal protective equipment, because something that protects others from you is not personal protective equipment. So if you've done your risk assessment or the Reopen Saskatchewan guidelines say that you need to have PPE specifically for certain tasks, it has to be approved as adequate PPE for COVID. So in Saskatchewan, this would be a Health Canada approved surgical mask or a respirator if the situation warrants it. And the thing about PPE, the main limitation of PPE is that it has to be used properly to actually be effective. So this is why we consider it the last line of defense, because it's not super easy to use PPE properly 100% of the time. So that's why we want to put other controls in place so that if your PPE fails, or if you forget to use it properly or something like that, then you're still going to be protected. So properly means according to the manufacturer's instructions and any safety regulations for it. It involves training in its usage, how to don and doff it, inspection training, and how to dispose of it properly. And you can check out the OHS regulations, section 87, for all the rules about PPE. So I want to talk about redonning masks, which this is for medical or non-medical masks. So a PPE medical mask or just a non-medical mask that you're using as a precaution. So once you remove, and the word for removing of PPE is doffing, once you remove it, it is actually considered potentially contaminated. If you've been around somebody who may have breathed or coughed or got their respiratory droplets on that mask, the outside, this is why they say don't touch the outside of the mask, because there might be respiratory droplets on it and it's considered potentially contaminated. So if it's disposable, the the recommendations for proper use are going to say throw it out, unless you can somehow disinfect it before you reuse it again. If it is a reusable mask, so like a cloth mask, the recommendations are to wash it before putting it back on. If you're requiring your staff to wear a non-medical mask, so a cloth mask, then they should be able to change them out when they need to without having to re-don a potentially contaminated mask. So you shouldn't be like giving your staff one mask for the entire week or something and saying, continue to wear this for your entire shift. That's just not appropriate. What are they supposed to do if somebody sneezes on their mask, or if it gets dirty, or things like that? They should have enough masks that they can change them out when they need to throughout the day without having to accept that risk of potentially touching contamination on the outside and putting it back on their face. If you are requiring your staff to wear medical masks as PPE specifically, requiring them to re-don those masks without actually having a chance to disinfect them could even be considered a violation of the OH&S regs, because the manufacturer's instructions for these will say, do not put back on a mask once you take it off if it's potentially contaminated. And then I'm just going to talk briefly about surgical masks here in aerosol. So surgical masks, they're designed to prevent liquid from getting into the wearer's nose or mouth. They're basically a splash guard. They have and the official approved surgical masks have some sort of like a barrier material in them that will prevent these like wet droplets from soaking through the mask and getting into your mouth, but they do not filter air effectively. So there are like lots of studies that you've probably seen online where they say, well, cloth actually filters 50% of particles as opposed to N95, which filters 95% of particles, but that can only really be interpreted that way if you're putting the cloth onto a tight-fitting respirator. Because if you're wearing something on your face that isn't tight-fitting, the air that you suck into that mask is always going to follow the path of least resistance. So it's going to suck in through the sides, the gaps on the sides on your chin or above your nose. So if you've worn glasses with a cloth mask on, for example, or a surgical mask, you know how your glasses fog up? That's because the air is leaking out through that gap and not filtering out very much through the mask. So actual respiratory protection, which filters air, such as an N95 respirator and fits tightly to your face, is very expensive. Currently, it's very hard to come by unless you work in a hospital, and it also requires specific training and fit testing to make sure it seals to your face properly. So if you actually do have an ongoing aerosol transmission risk in your workplace where you think you need N95s or respiratory protection, surgical masks are not going to be effective for this risk. Cloth masks, same thing. They're not going to be effective for this. Just because it says they can potentially filter 50%, they're not going to be filtering if they're not tight fitting to your face. So if you do think you need respiratory protection in your workplace, I would definitely recommend consulting a qualified occupational health and safety professional for this. You can contact the government of Saskatchewan to get in touch with one. You can contact me or a local safety place that can do fit testing and stuff like that with you. And just a bit more on mask safety. So this is a graphic from the Public Health Agency of Canada. They put out a poster recently about do's and don'ts of non-medical mask use. And the thing is that some people just cannot safely wear a mask. So this would be people who have illnesses or disabilities that make it difficult to put on or take off a mask, or have difficulty breathing, or children under the age of 2. So to be more inclusive, it is better to, if you want people to wear masks in your business, it's better to encourage it. But if you mandate it, then you may run into the risk of having people who shouldn't be wearing masks wear them in your workplace, or just losing out on those people who can't wear them. So if this goes for your staff as well, so if you're going to be putting a mask policy in place in your workplace, make sure that your staff are aware of this and encourage them to consult their doctor if they have concerns about their ability to wear a mask, and be prepared to figure out what to do if their doctor says they shouldn't be wearing a mask. And it's also just it's stressful to enforce customer behavior. And so if you're going to be asking this of your staff to enforce mask usage and stuff like that, just make sure that this behavior, either wearing a mask or anything else that you're putting in place that needs to be enforced, is actually going to be effective in reducing risk and not just kind of a keeping up appearances thing, and is actually a reasonable expectation, because you don't want to add this extra stress on people if it's not really even doing much. So that's kind of it for masks. And before I go into the actual risk assessment process and going through the worksheet examples, I just want to talk about the word should. So we've had lots of, we've seen this word a lot in things like Reopen Saskatchewan or other guidelines. And the reason that the word should is used more than things like shall is because it helps incorporate flexibility. If everything said shall, then that would put a lot of people in a position to be doing controls that maybe don't necessarily work at all for their business. So it's not shall, but at the same time, it's not if you feel like it either. It means that if it's feasible, do it. But if you don't do it, if it's not feasible, then be prepared to explain why that you aren't using it to customers or inspectors or anyone else. So for example, if a customer comes in and says, I don't like the fact that your cashier isn't wearing a mask, then if your situation is, well, we have put this plexiglass barrier in place to prevent any respiratory droplets from getting between either you or the cashier. And we've also extended the countertop 6 feet, so you can't even get 6 feet of them if you tried. And we also have our door, which is right here by the cash register, propped open, so we're getting a lot of natural ventilation in. So all of these controls that we put in place, we find are more than enough to reduce the risk effectively, so that we don't need to have our cashier wearing a mask all day long. So it doesn't mean it's a bad thing that you're explaining why you didn't do it, but just understand why you haven't done these things if you should do them. So using the risk assessment worksheet now. So if you have a copy of it, you can look at it, or we will just kind of put a little bit of it up on the screen too, so you don't necessarily have to. But the way I would suggest using this is first, like kind of, if you can possibly, forget that you've even seen Reopen Saskatchewan guidelines or any additional guidance that you've been given from a professional organization, etc. And then use the worksheet and the guide documents and break each job at your business into steps as you would have performed it before COVID, if you can remember that time, which seems like it was about 10 years ago. And then perform the risk assessment for each step and then suggest possible controls. And it's really ideal if this is done by the staff who actually do these jobs, because they're the ones who know their jobs best and will know what kind of controls are actually feasible, and they might think about things that other people didn't. And this is also part of their right as a worker in Saskatchewan, their right to participate in putting controls in place for hazards that they may face on the job. So then once you've done your risk assessment and suggested some controls, now I would say go back to the guidance like Reopen Saskatchewan and then reconcile your suggested controls with any requirements that you might have missed, or maybe they have a better idea in there that you just didn't notice, and then make your final decisions, which could be a mix of short-term decisions and longer term if you need to save up for some or get special permission or things like that. So we'll go through the 2 examples on the worksheet, and I did use just restaurant examples, but and I will say that just because I've used this as an example doesn't mean that this is what I think is the very best solution. This is just an example of what could maybe work for one specific business, but this isn't the be all end all in saying this is what you should do in this case. So the example here would be taking customer's order. And so this involves the server verbally communicating with the customers at their table and retrieving their menus from them. So what are the transmission risks here? Is there a person-to-person transmission risks? Yes, the server is going to be under 2 meters from the people, from the customers, and there's also a contact transmission risk that handing that menu back and forth between people. So what are some potential controls and the levels that they're at? So you want to start with eliminate. Can you eliminate this task? Well, in this case, you actually possibly could. If you said you want to do reservation only and have everyone pre-order online before they even come in, you can actually eliminate this task. But if that's not going to work for you, a way to substitute it could be putting a chalkboard menu on the wall for people to order and then have them or using disposable menus, so you don't have to hand that back and forth. Ways to engineer this could be having plexiglass at the cashier and having customers order at the counter. Administrative controls in this case, so rules or policies or procedures, could be having customers wear masks until their food comes, putting a marking on the floor for the servers to stand when taking the order 2 meters away so they don't get within 2 meters of the table, or just disinfecting the menus when they come back. And PPE could be the server wearing a surgical mask when taking an order. So then you think about the feasibility of this. So I've just put like the money symbol and the happy or sad to symbolize the costs or the social considerations. So elimination could be, I mean, the cost could be low or high, really depending on the method. If you're gonna put some fancy software in place, that might be high cost. If you just have people email their orders, it could be low cost. But the potential issue is this won't allow any walk-in customers. So maybe a large part of your customers are walk-ins and this isn't gonna be feasible. Substitution feasibility could be a chalkboard menu. Cost is pretty low. Maybe ongoing paper disposable is a high cost as well as a high environmental cost. A plexiglass is maybe a mid-range cost, like it's kind of high to start, but it's just a one-time cost, but it is effective. But maybe you have limited space at your counter for a lineup and you don't want to have people congregating over there. The administrative, so wearing masks and disinfecting menus, it could be a high cost to continually disinfect menus, both in time and cost of disinfectant. And maybe customers won't like wearing masks, or they just won't use them properly. Maybe they're pulling them up to talk to each other anyway, so maybe that's not really that feasible. Or PPE, the costs of surgical masks are ongoing, of course, and they might create communication issues if people are trying to talk through masks and not understanding each other, so that could be an issue. So maybe the final decision that people would reach in this case, and this is again just one example of a decision, not necessarily the best decision, but if you want to eliminate, you could say, we're not going to have walk-ins, just reservation only. Customers will pre-order over the phone or email when reserving, and the weekly menu will be posted on the Facebook page. So this is really low cost. You could try this to start, and if you're not getting enough customers this way, then add a chalkboard menu and have people order at the cashier. So that's layering a substitution and an engineering control together to lower risk. The second example is a customer task. And so these are things you want to be considering too, not just your workers' task, but how to keep customers safe as well. So this one is customers sitting at their table to socialize and eat. And so the transmission risk here is between parties at different tables. It is not your job to ensure that people who have come to the restaurant together and made that decision to dine out together are not going to transmit COVID to each other. So the transmission risk here is mainly person to person between tables that are next to each other. I don't think you're going to be having people touching stuff between tables, and even if you did, that would not be something that's considered like a high possibility of occurring, so you wouldn't need to put that in there. So some potential controls here, starting from the top. Elimination could be just not having this task, continue just doing takeout and delivery. A substitution would be outdoor dining, so substituting the indoor ventilation for outdoor ventilation, so it's just safer. Engineering could be spacing the tables 6 feet apart, which you are required to do in the guidelines, and maybe propping open outside doors and windows just to improve your indoor ventilation. Administrative could be limiting your restaurant capacity, which is required again, having customers wear masks until their food comes, and having a time limit on tables to try and keep people moving through and not staying in the area for a long time. And then PPE is really not applicable for customers, so you wouldn't consider that for customer tasks. And then the feasibility again, so elimination, so that's takeout and delivery. Maybe that's not bringing enough money, so it's just not possible to do that like only. Substitution, maybe customers and staff would like the idea of outdoor dining, but you don't actually have the available space for it right now. You can, for engineering, you can definitely space your tables, and opening the doors is free, but of course spacing tables is going to limit the amount of people in there. So administrative, yes, the cap on the capacity is required by Reopen Saskatchewan, but it's going to limit the amount of money that you make. Customers might, again, not like a mask policy or not follow it very well, and not everyone can wear a mask safely as well. And customers might also not appreciate a time limit. So these are all things to, again, consider if they're going to, lose you business in terms of feasibility. So final decision here could be to just follow Reopen Saskatchewan for table spacing and capacity, keep the entrance door propped open if weather permits for ventilation, and encourage quick turnarounds by maybe bringing food out quick or having people pre-order things like that. And so then not forcing people out quickly, but encouraging them. And then maybe look into whether you can get a parking space patio. That would be like a long-term solution. So that's about it. These are the resources that I've talked about during this presentation. I don't want to talk too long because we can hopefully have some time for questions if people have them. But Reopen Saskatchewan, WorkSafe BC COVID-19 stuff is really good. WorkSafe BC is always an awesome resource to look at. The hierarchy of controls, if you want to read up more about it, just Google hierarchy of controls. The NIOSH page, they've probably done the most research into it at NIOSH in the States. If you want to read a lot more about PPE for infection prevention and control, there's a ton of information on the COVID-19 Sask Health Authority page. And again, those back to work safely guidelines by the American Industrial Hygiene Association will give you some really good info on ventilation. And the Public Health Agency of Canada is putting out really, really good evidence-based information on non-medical masks. So you can look there for more information as well. I do just want to say, be careful if you're using guidelines out of Saskatchewan, especially American guidelines regarding uses of PPE, or because it might differ from Saskatchewan. So for that, you want to make sure you're using local guidelines. So here's my contact information. I am contracted for Tourism Saskatoon for several more weeks. And so if you do have any questions about any of this as you're going through your risk assessment, if you want facilitation, or if you just have some questions, or if you want me to review your controls and put a second set of eyes on it, I'm happy to do so. I'm available to do so. So that is about it. Hopefully we have a few minutes left.
We do have a few minutes left, remarkably. And I just want to, before we open up for questions, and please, if you do have any questions, either raise your hand and I can unmute you, or you can just place those in the chat function. But our gratitude for you, Robyn, is endless. And you have shared such invaluable information with those of us who have been working with you on this task force. There's absolutely no way that we could have ever done this without you. And your work is going to support our resiliency and really demonstrate, not only within the tourism sector, but across all industries, how we can do good work and support our community members first and be able to really responsibly reopen our economy. So thank you so much. Cassie from 9 Mile, you had emailed me a question, and I'm hoping that your question was addressed within the presentation. If not, very happy to address any further questions from anyone. Thanks everyone for your comments. And in the questions, I'm very happy to answer anything in follow-up as well. So just a reminder that the webinar today was recorded, and we will be sending that out through our membership e-newsletter. And please feel free to forward that. And as Robyn mentioned, all of the work that she's done here can be supported individually if you are struggling within your own business to implement your own controls, or to create your own controls. I'm here to help. And I want to make sure that everybody knows that Tourism Saskatoon is committed to supporting this work going forward. So not seeing any questions in the chat box, just want to say another great thank you to you, Robyn. Your work here has been incredible. And a big thank you to, I think that this is a great demonstration of the strength of our community. Robyn was in conversation with one of our partners, and he quickly reached out to me and said, hey, I think you really need to talk to this lady, and her work has been all presented to us. So just wanted to have a quick read here from Sean.
And I do want to say too, I know it was a lot of information, and sometimes it's hard to think of questions with stuff that's totally new. So if you think of something later, please, you can get in touch through Steph or Tourism Saskatoon, or through me directly at this email address here. So it's totally okay to reach out in a week and say, oh, actually I thought of this from that presentation or whatever. So I know it's something that can be kind of shy to ask a question about something totally new in front of a whole bunch of people. So
one question from Sean Moen here: does many of the preventative measures and enforcement have been through the Public Health Authority? Do you see an upcoming role for OH&S, Robyn?
I don't know. I mean, that's a question more to I think it should be, but I don't know if that's what that's a good question for the government, really.
Mm.
I think I would like to see that, because OH&S they're the people that are the experts in hazard mitigation, and I know that the health authority is experts in infection control, but mainly with hospitals and stuff like that. And so I think that there is definitely it's a good idea to partner with both infection control experts as well as safety professionals to kind of pull in all of those areas of expertise to make sure that we're putting the best types of controls in place.
Awesome, thank you. And I think that there's been a lot of examples for folks who are providing food and beverage services and whatnot, but this is going to be integral to support any of us. And I just want to remind everyone on the call today to please forward this information and share this information. This is a destination-wide commitment. This is not tourism sector specific. We will be using this worksheet to reopen our own office eventually, and I hope that everyone does find that valuable. So again, thank you, everyone, so much for your time today. I think that thanks, Cassie, for your comment here, for the clarification and to things to contemplate. I think everybody has a lot to think about here. I just want to draw your attention, Robyn, just to a few of these comments of gratitude here in the chat functions. So everyone, that brings us almost to 11 o'clock, and we've successfully maintained our commitment to time. Robyn, well done. And thank you, everyone, so much. We will be providing links to this recording and all other information. Have a great day, everyone.